It is critical to measure clients' emotional and behavioral status throughout treatment because we need objective measures of the degree of progress or lack thereof during CBT treatment. At the beginning of treatment, we collect baseline data that measures clients' emotional state and behavioral status. We need to know the types of difficulties experienced by clients, the severity of those difficulties, as well as the impact of those problems on clients' daily functioning. In other words, we try to quantify the reasons that brought clients to treatment. You can find many clinical instruments for gathering this data in the public domain. There are also instruments that require a fee before you can access them. You can find a sample list of these tools in the Extend Your Learning section of this module. We encourage you to use these tools through treatment. CBT therapists frequently use short scales for depression and anxiety to get a general sense of clients' overall levels of distress. When working with a particular condition, it is helpful to select a diagnostic-specific instrument to track progress. Other scales measure clients' level of functioning. Instead of capturing a list of symptoms clients have related to a specific condition, a level of functioning scale captures the degree of impairment that people have as a result of their conditions. All in all, there are many different instruments that measure different kinds of things. It is also common for therapists to use a 0 to 10 numeric rating scale to measure clients' distress or degree of improvement. This tool can be used to check in on a number of issues, including the severity of anxiety or depression, strength of cravings to use a substance, functional interference of flashbacks, level of relaxation, or enjoyment experienced from a social outing. To summarize, there are many different scales and tools that we can use to track treatment progress. It is up to us to decide which instruments best measure the types and degrees of problems that our clients experience and need help with. As I mentioned earlier, we capture baseline data to understand the type and severity of concerns our clients are having at the beginning of treatment. We then continue to measure their symptoms and the level of functioning throughout the episode of care to know whether or not they are benefiting from treatment. In CBT, we typically ask clients to fill out questionnaires at the beginning of each session. Again, the choice of a specific measurement tool is up to your discretion. The important thing is that you repeatedly collect data starting from the very first session in order to monitor the progress being made by your clients. Another important way of recognizing progress being made by clients is by tracking their successes in completing action plans. At Beck Institute, action plans are defined as assignments or activities completed between therapy sessions. Successful completion of action plans most often is associated with improved mood, higher levels of functioning, and progress toward achieving treatment goals. Whether using questionnaires, scales, tracking the completion of action plans, CBT therapists carefully analyze the data they collect from all clients. If the data shows that clients are not improving in terms of their mood, level of functioning, or progress on their goals, you need to consider modifying your treatment plan. Before you modify a treatment plan, you need to discuss this with clients. Together, you should review any treatment methods used so far and discuss whether or not treatment goals are appropriate and realistic. It is also important to investigate whether or not the measurement tools are sufficiently sensitive to track the changes, and whether there are external or logistical issues interfering with the client's ability to fully participate in treatment. As therapists and clients identify barriers to progress, they may collaboratively decide to modify the treatment plan in order to make it better suited to clients' needs. Next, I would like you to watch the following conversation between me and Dr. Cotterill. We will share our thoughts on effectively collecting progress data and accordingly modifying treatment plans with our clients. Norman, in our CBT sessions, actually from the very first session that we have with clients and every session thereafter, we ask them to complete checklists, surveys, tests. We ask for numerical ratings of their moods and their behaviors. And sometimes clients are not real happy about the fact that we ask them to do that stuff so much and repeatedly.
Yeah.
What is your experience with this in terms of how you explain to your clients, first of all, why we do this, the utility of it, and then maybe something about the choices you have in how you collect the data?
Yeah, it's an important question. It's hard to change what you don't measure. And the purpose is to serve you the best. We need to measure the very things you want to improve in your life. And I could ask you, well, how do you feel?
Okay.
Okay, that's what I get if I just ask you. But I need to, in order to get more detail than that, than just okay, I'd have you fill out the scale, which asks questions in much more detail than just merely saying okay. That's why we do the symptom checklist, because they can differ. That's why we do the depression inventory, because those symptoms can differ. And just like when you go to the doctor, doctor takes your temperature and takes your blood pressure. He can just ask you what your temperature is, ask you what your blood pressure is, but it serves you better for the doctor to take measurements.
Okay.
And it serves me better for me to take measurements from you as well.
Do you have preferred ways of doing this or preferred scales that you use?
Well, traditionally speaking, it's been the Beck Depression Inventory that I've been using from the very, very start, and Beck Depression Inventory second edition now, BDI2, and the Beck Anxiety Inventory that I like using as well. And I can give them feedback, because if you have a score, let's say 0 to 13 in the Beck Depression, I can say that's pretty much normal. If it's between 14 and 19, I say that's pretty much in the mild range. Between 20 and 28, it's pretty much in the moderate range. Above 28, pretty much severe. So it enables you to keep track of that. And same thing with anxiety scale. If I say that your anxiety score is between 8 or lower than 8, that's pretty normal. If it's between 8 and 16, I say it's pretty much in the moderate range, or mild range. 16 to 28, we're heading more towards the moderate, and then above 28, goes all the way up to 63, more severe. And so they can get a record of that again, and as far as the intensity and severity. So I use those scales. Also have used the hopelessness scale as well, and also have used the Y-box, which for for obsessions and compulsions as well. But sometimes it makes them homegrown ones. I have a client now who reports symptoms of feeling, have feelings that he describes being fuzzy, layered, burning, and dry. So I have the.
We don't have scales for those.
I know, but I do. I have them keep track of how fuzzy is, the fuzziness scale, the burning scale, the layered scale, and the dry scale. Those are the 4 criteria.
And what is do you have numerical ratings for those?
Yes, absolutely. I mean, that's what works. I say how it is on a scale from 1 to 10. And we can keep track that way, how fuzzy, layered, burning, and dry. And they differ. And also, I even ask them, how fuzzy are you right now at this moment as we speak? And what was the least fuzzy since we last met and the most fuzzy since we last met? So kind of a range of scores. Because there's some things, the Beck Depression Inventory asks how you've been generally over the past week. It's just a general measure of how you've been over the past week. But sometimes I ask clients, how they are right now at this moment. What's the least they've been and what's the worst they've been? And then sometimes it's even good to ask them how they rate themselves at the end of the session. Because there are changes the clients can make at the beginning of the session to the end of the session. How'd you feel before we started? How you feel now that we ended? So you can take a measure just to measure the improvement within the session, just to show what changes you've made just over the course of the 45-minute hour. And also, you can do it with techniques. I do that as a matter of course with, let's say, an anxiety scale, panic sensation scale, in which they can rate how they feel now on that scale, and we do relaxation techniques, or we do a mindfulness technique, or we do a breathing technique, and how they feel afterwards. And I'd say, here's something that we did that reduced all these symptoms. You're less lightheaded, less dizzy, less in terms of fatigue, less in terms of heart racing. All these symptoms went down just from us doing this procedure over the past 20 minutes.
Yeah.
What do you make of that?
So in addition to, what do you make of that indeed? In addition to being feedback for the client in terms of their condition and their progress, it's really good feedback for us, the therapists, because we know whether or not the treatment plan that we have developed and are applying is achieving the results that we had hoped for and that the client had hoped for. So it is useful not just to the client, but to us as well to know whether or not the treatment that we're providing is doing what we want it to be doing.
And I serve you better operating without a blindfold. They need to see. And you can see as well, to see these things make a difference in 20 minutes, or in the course of a session, or in the course of a week, or for that matter, in the course of 10 weeks that we meet.
So that's great. I think you've given the therapists who are listening to this some really good ideas in terms of explaining the rationale to their clients and also how to use the results that they're getting from these things. Thank you. As we described, there are many options for assessment to choose from, and monitoring progress is crucial to practicing good CBT. Your assignment for this lesson involves researching assessments that you might want to use in your practice. This is the final lesson in Module 1. Throughout this module, we described 7 core elements of treatment planning. They were establishing a therapeutic alliance, obtaining relevant background information, eliciting clients' values, aspirations, and goals for treatment, completing a conceptualization, structuring a CBT session, collaboratively selecting treatment techniques, developing a means of tracking the progress. I hope that you will refer back to these lessons throughout this course and long after. Treatment planning is crucial to doing CBT in the way we teach it at Beck Institute. I hope that you find that you develop and cultivate these skills throughout your career. There's no end to developing your skills as a therapist. In the next module, you will build upon what you learned as we take a deeper look at cognitive conceptualization diagrams.